name is Sarah Durlam, and I'm a physical therapist here at the PTOSI Minneapolis clinic. And we're talking today with Mandy Labrosse. She's a pelvic floor physical therapist at our clinic. And we just wanted to talk a little bit more about pelvic floor physical therapy because it's not very well known what it is and what it entails. So let's go ahead and start with you telling me a little bit more about yourself, who you are and what you do.
Yeah, like Sarah said, I'm Mandy Labrosse. I'm a physical therapist here with PTOSI at our Minneapolis location. And I have been a physical therapist for a little over 12 years, and I started specializing in women's health or pelvic PT about 5 years ago. And I just really love sharing pelvic physical therapy with people because I feel like Sarah said, a lot of people don't know what it is and they don't even know it exists. And so we just want to get the information out there and hopefully get you guys to come see us. Where do you want to start, Sarah?
So let's just talk first about what is pelvic floor physical therapy.
Yeah, so pelvic floor physical therapy is PT that focuses on the pelvic floor. So if you think about the anatomy, so here's our pelvis. The pelvic floor muscles are here, so they're kind of an extension of our core, and they really help with bladder and bowel support, sexual function. And the muscles are just like any other muscle in the body, so they can become tight, weak, and certainly cause a lot of pain. So we kind of see two, I would say, main groups for pelvic floor physical therapy: those who are having leaking or incontinence, and then pelvic pain.
Okay, so kind of springboarding off that, who could benefit from pelvic floor physical therapy? What kind of person do you typically see?
Yeah, so certainly kind of things I already mentioned. So people who have a lot of leaking with both urinary or bowel issues, women who have pelvic organ prolapse, so that kind of heaviness or fullness in the vaginal canal, pelvic pain, and that includes intercourse, or pain with intercourse, pain with penetration, and that's for both men and women for all of those, as well as women who are pregnant or postpartum. So I see a lot of women pregnant who have some of those issues or just want to kind of prepare for their birth, and then certainly postpartum, some of the leaking, a separation of the abdominal wall or diastasis recti is super common. And I'm a huge proponent to get people in here postpartum. I feel like a lot of women have a lot of impairments that they may not necessarily know that could cause issues down the road, and so really just seeing women and kind of giving them a good start postpartum. Its standard of care is about 6 to 12 visits in Europe, so I definitely feel like we're kind of trying to get more towards that.
Very good. And then a lot of times people will say, my doctor just told me to do Kegels. Is that enough, or is there something more involved with that?
Yeah, that's a great question. I hear that from a lot of people. First, Kegels aren't necessarily something that everyone should be doing. They're just, like I said, like any other muscle in the body. So if the pelvic floor is already painful or restricted, Kegels are actually going to make it worse. If you think about, like, I like to say the biceps analogy. So if my biceps is painful or overworked and I do a ton of biceps curls, it's probably going to make the matter worse. And so not everyone should be doing Kegels, and so certainly consulting with a physical therapist would let them know that. And then secondly, a lot of people just don't know how to do them correctly. So research actually shows about 50% of women do them wrong or ineffectively, and so making sure you're doing it correctly is going to give you the most benefit. I like to use the marble analogy with my patients, so I tell them to think about trying to pull a marble up and in, which is going to get you the best contraction.
Very good. And then how do I find a pelvic physical therapist?
Yeah, so I would say the easiest way is probably to go on the American Physical Therapy Association website. In the women's health section, you can actually search for PTs by location. We can post that link on our site too, or on the video. And then just remember that you may need a referral from your doctor. So some people can self-refer and don't have to see a provider, and other people do need that order, so make sure you check with your insurance.
Okay. And then what can someone expect when they come to pelvic floor physical therapy? What kind of things do you do, and what does the examination entail?
Yeah, and I think that's a great question. I feel like a lot of people don't know what to expect when they get here, so I like them to know what to expect. And so I do a full evaluation. So I'm looking at the whole body. I'm going to look at your spine, posture, strength of all the muscles, definitely the abdominal muscles, and then I do usually do an internal exam, either vaginally or rectally. That is really the best way for us to assess the pelvic floor. However, there are definitely less invasive ways, so if that's not something you're comfortable with, certainly don't let that keep you from coming to physical therapy.
Okay, so it sounds like typically there is an internal exam and it's the best assessment, but if I'm not comfortable with an internal exam, there are alternative ways, so that shouldn't keep me from coming in the door.
Yeah, definitely.
Okay. Well, thanks so much for answering these questions. It was really informative, and if you have any questions, feel free to give us a call or check our website, and thanks so much for joining us.
Thanks.